School bus drivers operating ambulances, a spike in need for hospital ventilators and social distancing as the best way to slow the virus. These are all plans in the Knox County Health Department's novel virus pandemic response.
10 News reporter Cole Sullivan obtained the document laying out the plan for a worst-case scenario.
We are not there yet, but there is a plan for a worst-case scenario. 104 pages of dire assumptions about a deadly virus and how Knox County will respond. A spokesperson says the department is updating this plan for the coronavirus. It is important to be clear, the existing document is based upon a pandemic of the severity of the 1918 Spanish flu. Still, the similarities to coronavirus are clear. The document prepares the county for a virus deadlier than seasonal flu, especially for people 65 years and up. First responders will be among those first impacted.
And first responders do come in contact with the numerous infectious diseases in their day-to-day work.
During a severe pandemic, the county plans at least 40% of the EMS workforce could be depleted, in part because of illness. If the ambulance company's backup plans do not work, Knox County school bus drivers will step in. The plan says they know the county roads and schools will already be closed. Hospitals will be impacted too. The plan says in a worst-case scenario, demands for ventilators could increase by 25% or more. The plan also assumes there could be 2 or 3 waves of the pandemic. All in all, it could last up to 2 years before the virus becomes a routine seasonal strain. The health department says it's too early to know if that's true for COVID-19.
The cases in China are going down. Are they going to go back up again? We don't know that until we see that.
10 News reporter Cole Sullivan joining us now live. And Cole, while we are not there yet, this once again a worst case scenario plan. We have to reiterate that. It does mention the social distancing. We talk about it a lot, but it's something health leaders say that we should already be doing.
Yeah, the plan talks extensively about social distancing. It calls it vitally important. It can't emphasize enough how important social distancing is, really. Vaccines take time, treatment takes time to develop, and in the meantime, the key to maintaining a low spread or slowing that spread of the virus is social distancing. It says that social distancing is central to minimizing illness and death in Tennessee.
And Cole, when we are talking about social distancing, we're talking about staying 6 feet apart, avoiding large crowds, that sort of thing. How important is there the need to do that here in East Tennessee when truly we just have a handful of cases right now?
I asked the director of the health department that earlier today. She says a lot of the guidance we've seen is set by the federal and state government. That's not to say it's not a best practice for everyone here as well, and not that it might not be coming here as well. She used the example of a restaurant. Instead of going to your favorite restaurant for dinner, maybe order takeout or delivery instead. For older adults, especially people with chronic health conditions, she says they do need to be more careful here in East Tennessee and be very thoughtful was the word she was using. When you go outside and interact with others, you want to consider the risk that you might contract this disease. That's for older adults and people with chronic conditions especially. Robin?
Important information to continue sharing. All right, Cole Sullivan live for us. Cole, thank you.